Welcome you back to downtown Los Angeles. Pistons and the Clippers on tap for the first of their two regular season meetings. They'll meet in mid-December out in Detroit for the second and final meeting of the year. So we welcome you back up high above Star Plaza. Mark Rogandino with Dr. Gabriel Zada from Keck Medicine of USC. And we saw the other night against the Phoenix Suns, it was Ronnie Price of the Phoenix Suns who got a knock to the head, and he was out for the rest of the game. We would learn a little bit later that he had a concussion and could not go. And when you talk about concussions and traumatic brain injuries, it's really on the forefront of the world of sports right now. Is there anything you could do to maybe prevent them or stay away from them, as you and I were discussing earlier, outside of just sitting in a dark room and not being a participant at all?
There are certain things you can do, and obviously sports are very important to our culture. We don't want athletes to not engage in sports. So it's really about safety. It's about a culture of transparency and awareness and prevention whenever we can do that. There are various things you can do in high-impact contact sports. Of course, protective gear is very important. In things such as basketball, it's a little more challenging. Fortunately, there are not a lot of concussions in basketball, but we've now implemented much more strict guidelines for assessing players and then return-to-play guidelines, things like that. So,
you know, you look, even if, again, Ronnie Price had a concussion the other night for the Phoenix Suns, but obviously you see a lot more in the world of football, in the world of hockey as well. And it's something that we hear the term thrown out, he's going through concussion protocol. What exactly is that?
So over the last decade or so, we've developed protocols where medical professionals can assess players, and we really promote a culture of transparency. We want players and athletes to be very honest about what they're going through and experiencing to prevent any re-injury and really know that it's safe before they come back to play. So that includes objective, standardized tests, including questionnaires about how athletes are feeling after a concussion, and we test things like their balance and neurological exam, and we test them sequentially to see when we think they're safe to re-engage in play. That includes a stepwise protocol to going back into play with first no activity at all and then going back to light aerobic type of exercise and then maybe non-contact type of play, and then finally they can re-engage in full contact athletics once we think they're ready to do that.
So I guess if I'm reading between the lines here, the message is long gone are the days of, oh, just put a little dirt on it, rub it off, and get yourself back out there, kid.
Those days are gone, and that's a good thing. We want to emphasize long-term quality of life and the health of these athletes over decades rather than put them at injury for any kind of second type of concussion or a repeat mild traumatic brain injury, which we know can have long-term lingering effects. So it's really about the safety of these athletes, prevention, awareness, transparency.
Well, we appreciate you stopping by, shedding a little bit of light on the subject. Obviously, we've had a long-standing partnership with all these good doctors over at Keck Medicine of USC. Dr. Gabriel Zada joining us here on Clippers Live. Right, when we come back, we'll get back to basketball here and the talk of the Clippers getting back.